Chairman Dr. Burgess, Ranking Member Green, and distinguished members of the subcommittee, thank you for the opportunity to appear before you today and discuss the workforce programs under the Public Health Service Act on behalf of the Elder Care Workforce, which is a group of 31 national organizations representing consumers, family caregivers, healthcare professionals, that includes direct care workers, joined together to address the immediate and future need for more expert health professionals to care for all of us as we age. I'm also very pleased to be joined by colleagues from across the country who work tirelessly to improve the health of our nation's population. Today, I am here to discuss the Title VII Geriatrics Health Professions programs, which are focused on enhancing the ability of America's healthcare workforce to provide high-quality care for older adults. These Title VII funds support 44 geriatric workforce enhancement programs we call GWEPs, and we are GWEPsters, which trained almost 19,000 emerging health workers or trainees in over 45 professions and disciplines from 2015 to 16 academic year. Collectively, the GWEPs are leveraging the skills of geriatric health professionals already in short supply across different professions to educate other members of the workforce, caregivers, and direct workers, healthcare workers. Many of our trainees had little or no exposure to geriatric principles before our programs. I would like to tell you a story about how GWEP changes the lives in my home state of Texas, where the current population of older adults is 5.9 million and growing, so I have constant job opportunities in Texas. I'm at the University of North Texas Health Science Center, located in Fort Worth, Texas, where I am faculty and I'm a practicing geriatrician. Our GWEP is called the Workforce Enhancement in Healthy Aging and Independent Living, or the WeHail program. Since January of 2016, we've offered rural communities free programs focused on Alzheimer's disease education to almost 500 older adults and their family caregivers. Caregiving for someone with Alzheimer's disease is extremely stressful and unpredictable. I can speak to this not only professionally but personally, as my both grandmothers and my mother now is afflicted with Alzheimer's disease. So we really need to try and reduce that stress and help them with problem-solving skills so that they can continue to keep their loved ones at home where they would like to have them. We've had also training for our physical therapy students and medical students in trying to teach older adults about falls prevention, which, as you know, can be very serious consequences for them. They participated in an evidence-based program called A Matter of Balance, that's lay leader training. The students in turn then go out and do falls prevention workshop in senior centers, and we've basically gone to about 14 of them, touching almost 300 older Texans. Across health professions training, there is a paucity of content focused specifically on ensuring the healthcare workforce of tomorrow has the skills and competence to care for all of us as we age. Our GWEP is filling that role in Texas and the gap because we have trained to date almost 2,000 students to be our future doctors, nurses, social workers, pharmacists, physical therapists, dietitians, and physician's assistants, and we have them working as interprofessional team training. We're also working with primary care practices, healthcare systems, and the Aging Network Social Services by training interprofessional teams of current practicing professionals to try and help them with patient-centered primary care for older adults and looking into the new integrated delivery systems. In fact, we have 6 more training teams that are going to start Friday, tomorrow, at our university. This year, WeHail has received innovation awards from the National Association for the Area Agencies on Aging and the American Public Health Association, and we believe this demonstrates the widespread recognition for the need for high-quality, integrative, and collaborative geriatrics training for health professions. There are 43 or other GWEPs across the United States, and they are trying to improve this current and future care. But the need for the programs will be greater. As you know, by 2030, we're going to have 20% of our population over the age of 65. That'll be about 70 million people, and we already have about 19 million caregivers trying to help older adults. And our GWEPs, we are definitely a community of learners and collaborators. We love to share our ideas. We have a national GWEP network, the National Association of Geriatric Education, and the John A. Hartford Foundation GWEP Coordinating Center out of the American Geriatric Society. I know that, like us, my colleagues at the other GWEPs are leveraging their GWEP funding to create lasting change on how they deliver care at their institutions and in their communities, and we are learning from each other about what works and what may not. We may be a small workforce, but we are mighty, and we are tireless advocates on behalf of improving the care for older adults. This funding offers each of us a platform for making that possible, for demonstrating how attention to core geriatric principles can improve the care we all provide. In just 1 year, according to the Health Resource Service Administration, we've collectively trained almost 19,000 trainees in over 45 professions and disciplines. About 11% of our trainees come from disadvantaged backgrounds or are underrepresented minorities in their chosen health professions, and we have partnered with almost 400 healthcare delivery sites to provide the trainees with that clinical training experiences in geriatrics. Thanks to our work, over 100,000 faculty and practicing professionals have experienced nearly 1,200 continuing education programs. No surprise to someone who's worked in the field of geriatrics, about 75% of our GWEP graduates receive training in medically underserved communities, and upon completion of the training are actually going to go back and serve in those communities. I am very grateful and encouraged by the hard work that this committee has done on the reauthorization of these programs. I'm especially grateful to Representative Jan Schakowsky for her leadership in introducing the Geriatrics Workforce and Caregiver Enhancement Act legislation that would increase funding for the only federal geriatrics program and reestablish the Geriatric Academic Career Awards, which was a previously funded program for developing clinician educators that ensures that the geriatrics academic workforce will be prepared to train our future geriatric workforce needs. So, Mr. Chairman, Dr. Burgess, Ranking Member Green, and distinguished members of the subcommittee, addressing the elder care workforce crisis and the other vital health professions programs under the Public Health Service Act is an opportunity we cannot afford to ignore. We appreciate the hard work the committee has undergone to reauthorize all the important health professions program. I thank you so much for this opportunity today, and I look forward to your questions.
Thank you, Doctor.